Hi, I'm Dr. Kristen Lettenberger. I am a pelvic floor and orthopedic physical therapist at Bespoke Treatments in New York City, right here in Midtown. And I specialize in pregnancy and postpartum rehab.
Amazing. So a question that I get a lot, and I think you might get a lot as well, is what is diastasis and what are ways to improve it?
Yeah, so diastasis, we call it DRA. So it's diastasis rectus abdominis. It means a separation of our rectus abdominis, which is our six pack, was what we kind of think of as our core. And it really means that the linea alba that starts up at the xiphoid process and works down to our pubic symphysis has separated apart enough where then you get pressure or coning out into that midline. Um, we measure it by width and depth of how much movement we can get. And we usually use our fingers to do this. So if we're having an increased width, say when we do like a curl up and you're seeing that coning, that's what we would determine as a diastasis. And then we would see the severity of it by how far apart those two rectus abdominis muscles are, where it's happening along the linea alba, because it can present in different ways depending on where we are assessing it. And then we see how deep can we get within that. So that tells us that we're
Mm.
not generating enough tension underneath the linea alba to support our core and then protect our organs. But it also provides some torso stability, which is a requirement to keep our spine nice and neutral and decrease low back pain, incontinence, hip pain. So all of those things can happen if you're experiencing a diastasis. And then for the second part of the question, how do we address it
Yeah.
and exactly how we assess it? So what we're looking to do is bring that rectus abdominis back in towards the midline and create nice tension down through that linea alba. So we work a lot on diaphragmatic control with our pelvic floor and integrating our transverse abdominis, which is our deepest most core. And that is a beautiful muscle that works from our xiphoid process all the way to our spine and down to our pubic symphysis. So it really is like our corset. So it
Hmm.
wraps and comes close to our spine. So we coordinate that, those three things together to decrease the separation, but we leverage it too to also create better tension through the linea alba. So that's very early stage. We teach people how to engage properly. And then we add in hypertrophy work for your rectus abdominis, which is your six pack, as well as your obliques to create a more functional, resilient, strong core.